My name is Felicia Watson. I am a PhD student in the pathobiology program in the Department of Global Health, and I am doing my dissertation research in Sean Murphy's lab in the Department of Laboratory Medicine and Pathology. Today, I'm going to tell you about my research on improving a two-step malaria vaccine. Malaria is a disease that causes an estimated 229 million infections and 400,000 deaths each year, and most of these deaths occur in pregnant people or children under 5. Over half of the world lives in areas at risk of malaria, so better vaccines are urgently needed to save lives and reduce infections. However, due to the complexity of the malaria parasite, vaccine development has been extremely difficult. Malaria is caused by a parasite that is spread to humans through the bite of a mosquito. Mosquitoes transmit parasites called sporozoites into the skin. These sporozoites go on to infect the liver for about a week before they invade into the bloodstream. This blood stage infection is the stage that makes you sick and can also be spread back to mosquitoes. So if we block this blood stage by killing off the parasites in the liver, we prevent malaria and we prevent the further spread of the parasite to new mosquitoes. There's an existing vaccine strategy called PFS-PZ that does just this and blocks the blood stage. This vaccine is a whole sporozoite parasite that has been weakened so that it does not cause disease. The vaccine is very effective in preventing malaria, but it requires repeated booster vaccination. And so our lab improved and simplified this vaccine into 2 steps. Step 1 primes the immune system with parasite DNA, and step 2 uses the same sporozoite vaccine from the standard PFS-PZ. And although our vaccine is effective, it still requires further optimization. One limitation is that the vaccine must be delivered directly into the bloodstream in a method called intravenous or IV delivery. IV delivery requires specialized training and is more difficult than standard vaccination. Most vaccines, including the COVID-19 vaccines, are delivered intramuscularly into the upper arm. Intramuscular injections deposit vaccine under the skin into the muscle. Attempts to deliver sporozoite vaccines without IV delivery have failed, and this is likely due to less sporozoites making it into the bloodstream, which is key for sporozoite vaccination. However, mosquitoes successfully inject sporozoites into people's arms. So we hypothesized that if we mimic the mosquito and inject the sporozoites into the skin, that this could be an effective vaccination route. Sporozoites in the skin move around until they find the bloodstream. Skin or intradermal vaccination is much simpler and easier for nurses in the clinic, and it would greatly improve overall sporozoite vaccine administration. Thus, improving intradermal vaccine delivery for malaria is the focus of my dissertation research. Mosquitoes are really tiny, and so they inject very small volumes of sporozoites into the skin. Standard vaccines use much larger volumes, which could be detrimental for the sporozoites. So we hypothesized that if we reduce the volume of the vaccine, we could improve the overall efficacy. However, we found that the small volume intradermal delivery was still not as effective as IV delivery. So to further improve intradermal delivery, we added an adjuvant drug. Adjuvants are substances that are added to vaccines to improve overall immune responses. We hypothesized that an adjuvant would help awaken the immune system and improve intradermal delivery. Here, I combined our sporozoite vaccine with an adjuvant called 70W85, which was designed to improve malaria vaccination. We found that if you add the adjuvant, we were able to improve overall intradermal delivery. So if we put everything together, we found that the combination of the low volume sporozoite delivery and 70W85 adjuvant was highly effective and could be delivered intradermally. We show for the first time that sporozoite vaccines can be delivered intradermally and achieve equivalent levels of protection to IV delivery. It seems like the combination of low volume and drug adjuvant is critical for effective intradermal vaccination. So in summary, we demonstrate that sporozoite vaccines can be delivered intradermally if you combine 70W85 and small volume intradermal delivery. This intradermal delivery is mimicking the mosquito and delivering sporozoites into the skin where they can migrate on their own into the bloodstream. This new vaccine administration improves the accessibility of the malaria vaccine, as previously it was required to be administered IV. IV delivery requires specialized training and is much more difficult and time-consuming for nurses. And as malaria impacts millions of people every year, improving vaccine accessibility is a major public health focus. And so here we demonstrate that we can further improve this existing vaccine to make it easier to administer.